Hi class, we are going to discuss antimicrobials today, anti-infectives. So this is from your book, chapter number, from your Karch book. It is chapter number 8, 9, 10, 11. So let's look at the PowerPoint and we are going to do our discussion through our PowerPoint. Okay, so when in your life have you ever taken your antibiotics? So this is anti-infectives. So anti-infectives, you know that in your life, there are times when you get like a little bit of cold or cough or you feel sick, and that's the time when you are actually wanting to take your antibiotics. You go to the doctor, you have a runny nose and sore throat, you go to the doctor and the doctor says, you know what, you need to take antibiotics. And then you're like, okay, I will take it. And then they write you an order for 5 days. And then you're like, okay, we're good. We're going to take it for next 5 days, right? So technically, what are antibiotics or antibacterial? Now, antibiotics are any medication that are against infection. What is infection? Infection is something where your body doesn't like bacteria, viruses, fungi that could cause technically problems. Antibacterial antibiotics. Antibacterial and antimicrobials are substances that inhibit bacterial growth or kill bacteria, other microorganisms, microscopic organisms such as virus, fungi, protozoa, and rickettsia. So what are those? Those are just those small little culprits that cause problems. So viruses, fungi, protozoa, and rickettsia. Antibiotics, chemicals produced by one kind of microorganisms that inhibits the growth or kills another. So these are just, and what are antibiotics? These are just technically the chemically made treatment medications that will help to kill that infection in your body, right? Antibiotics could be bacteriostatic or bactericidal. What is bacteriostatic? Bacteriostatic drugs inhibits the growth of bacteria. Examples could be tetracycline or sulfonamides. Bactericidal drugs could kill bacteria, penicillin, and cephalosporins. These are just examples of bactericidal drugs. So bactericidals are the one that will kill the bacteria, just kill them, right? But bacteriostatics are the one they don't kill them, but they will inhibit, like slow down the growth of it. Like if they're still there, but it will slow their growth. Okay, so that's bacteriostatic. Static means slowing down. Cidal means taking care of them, right? Kill them. Mechanism of action. So what is the mechanism of action? Inhibition of bacterial cell wall synthesis, alteration of membrane permeability, inhibition of protein synthesis, inhibition of synthesis of bacterial RNA and DNA, and interference with metabolism within the cell. Resistance to antibacterial. So what is resistance? There's times when people take antibiotics and they are just not acting. They're taking, oh, you know what, I am actually taking let's say penicillin or amoxicillin for 5 days, and I'm still having this cough or I'm having this infection in my chest, and it's just not getting better. So that means that their infection or the bacteria they have has gotten resistant to the medication they're taking. That is resistance. Okay, resistance to antibacterial. So causes could be natural or inherent resistance, occurs without previous exposure to the antibacterial drug, requires resistant, occurs in prior exposure to antibacterial. So sometimes when patients are taking a lot of antibiotics and they've been sick for a long time, they might just develop resistance to the antibiotic. Okay, nosocomial infections acquired while clients are hospitalized. So there's times when people are in hospital and they get some infections, such as, you probably have heard MRSA, methicillin resistant Staph aureus. So that one is, MRSA is not a good infection for anyone, because that means it is resistant to a lot of antibiotics, and so patient has infection, you give them antibiotic, doesn't work. Patients stay infected, patients stay sick. So that's not good. So those are nosocomial infections, something that you get in the hospital. Cross resistances. Cross resistances occur between the antibacterial drugs that have similar action. Okay, so like a person was taking one and then another one, and then it's like the bacteria is like, okay, you know what, we're just gonna stay there, and it becomes non-functional on them. Superbugs are like certain infections that stay in the patient's body, and when we're trying to give them a lot of antibiotics, strong antibiotics, and they're just resistant. So superbugs are MRSA, VRE, VRSA, vancomycin, and few other drugs work on these. If these bacteria become resistant to vanco, we would have to have a major problem. So there's times when vancomycin is a very strong antibiotic. There's times when with MRSA we want to give vancomycin. Let's give vancomycin, and if we give it and the infection just doesn't go away, that's not good for the patient, because then patient could get sepsis. Severe infections cause sepsis. Sepsis causes, severe sepsis could cause severe hypotension that could cause death. So those are called septic shock, right? So having infections and severe kinds of infection, and when none of the antibiotics are working, that's not a good thing for a patient. So antibiotic misuse and resistance. When antibiotics are taken unnecessarily or incorrectly, when we develop resistance to antibacterials, such as viral infections. So some viral infections, they don't need any antibiotics. There's times when we have some, little nosocomial, let's say I have rhinitis and I have a little bit of allergy, and I go to the doctor. Doctor says, you know what, you might have just a viral infection. You might not need any infection. Let's just wait for 5-7 days. There's times when it's like mild kind of infection, and they would do a culture, sputum culture, and they find out that they don't find any bacteria. They will say, okay, let's just wait, and the viral infections auto heal by themselves, unless they were severe viral infections that we give them antivirals. So if no infection is present, or incorrectly skipping doses, there's times when the doctor says, hey, make sure you take your medication for 7 days straight, and then there's times when the patient will feel better in 5 days, and then they don't take it. So there's times when patient is skipping a dose or not taking the full antibiotic regimen could cause resistance. Okay. And consumer education is important because many clients demand antibiotics for viral conditions, and antibiotics are ineffective against viruses. Culture sensitivity. What is culture sensitivity? When, let's say, a person come to emergency room and they say, oh, I'm having fever and I'm having cough, and my cough has a lot of I'm having yellow coughing, and then when they yellow sputum in my cough, and then the doctor say, you know what, why don't we just send this sputum for cultures? When we send it for culture and sensitivity, and then we are able to put the samples in specific areas for 3 days, we'll have the microorganism grow in that area and see what drugs could actually work on that bug, right? So that is called cultural insensitivity. And so we find out like which antibiotics are sensitive to that kind of bug. Then multi-antibiotic therapy. Daily use of several antibacterials delay the development of microorganisms resistance. So culture insensitivity should be sent before starting any antibiotic therapy. Before you give antibiotics, we do culture sensitivity before it. Antibacterial. So let's start on classification on spectrum. Now there's something called narrow spectrum and something called broad spectrum. Broad spectrum is like that are effective against, broad means bigger, right? Bigger spectrum means like more amount of coverage, like big coverage. So what does it mean? It means like you can give these medications to a lot of different kinds of infections, such as lung infection, such as respiratory tract infection, urinary tract infection. They could be given for arthritis or severe infections in the bones. So there's different kinds of infections, right? Infections could be in respiratory tract, they could be in urinary tract, they could be in GI tract. So these are different kinds of infection. So broad spectrum antibiotics. Could be effective against gram-positive and gram-negative organisms. Examples could be tetracycline and cephalosporins, frequently used to treat infections when offending microorganism has not been identified by culture insensitivity. Narrow spectrum means like smaller amount, like like such as erythromycin could be only given for, let's say, tonsillitis or throat infection or specific kind of infection, and they're not very effective on all kinds of infection. Basic penicillins. So basic penicillins are they are introduced to kill Staphylococcus, which is a very strong infection that could cause severe kind of infection. Some of the penicillins are amoxicillin, ampicillin, and neficillin. Nursing interventions: always check for culture sensitivity before the drugs are given. Monitor for bleeding. Monitor closely during the first dose. Increase fluids. Take 1 hour before and 2 hours after meals, and check for superinfections and consider safety issues. Now let's go on the term superinfection. What is superinfection? Superinfection means when you're taking antibiotics and your body flora, just a general body flora, it has a capability of killing those good organisms that protect your gut, that protect your skin covering. And once they are dead, then some other infection comes in, right? So that is called superinfection, all right? So amoxicillin. What is amoxicillin? One of the medications which is also in broad spectrum penicillin, which could be used for respiratory tract infections. Sometimes when people come in with cough, cold, and they are not feeling very well, and then the doctor says, okay, let's give them amoxicillin, right? So that is for respiratory tract infection. Sometimes they come in with urinary tract infection. Okay, amoxicillin, let's give for UTI, let's prescribe amoxicillin. Then otitis media, it is infection in the ear. Sinusitis, infection in the sinuses, right? Nasal in the sinuses area. So side effects could be nausea, vomiting, diarrhea, rash. If a patient reports experiencing a rash in the past with other penicillins, the nurse should contact the provider to discuss using a different antibiotics if this happens. So most of those antibiotics they have really bad side effects. Mostly, think about when last time you were taking an antibiotic. How were you feeling? You were having nausea, vomiting. Your mouth was just tasting bad. A little bit of diarrhea, like not very firm stool. And that's just a part of they're bad for GI area, right? Then a person could be severely allergic to antibiotics. Allergies could be rash, hives, irritation on the skin, and then it could be severe allergies such as shortness of breath, difficulty breathing. That could cause severe anaphylaxis. And remember what we give for anaphylaxis is something called as Benadryl, right? Antihistamines. So those are that are for severe allergies. So we have to make sure the patient's not allergic to those antibiotics when we're giving them. All right. So penicillin and amoxicillin, always before starting any antibiotics, we should always check. We should know their liver function test, their kidney function test. So liver function test is LFT, kidney function test is KFT. What is kidney function test? We want to make sure that their BU and creatinine is normal, right? So record their urine output. Low urine output indicates that the drug or the dosage may need to be changed. Drink plenty of fluids to promote excretion of drug. Take with food to prevent gastric irritation. Take entire prescription. Skipping doses can lead to drug resistance in the future. So don't skip the antibiotic dose when you're on antibiotic. Make sure you take it like a good 5-day course or 7 days, whatever the doctor tells you. Tell patient to stop taking drug if the rash develops. So if a person says, you know what, I'm having rash or hives, okay, don't take it. We need to, you're allergic to that medication. Then we have to educate our patient on that. And we should avoid acidic fruits, juices, and it could decrease the effect of amoxicillin. Cephalosporin, what is cephalosporin? Bactericidal. It is another kind of antibiotic classification. Some of the antibiotics come under cephalosporins. Those are broad spectrum antibiotics. Some of the examples could be Rocephin, Ansef, K-Flex. And evaluate labs for BUN, creatinine, liver function test closely. Now this is standard for all antibiotic. Always know that you have to check their kidney function test and liver function test. And something called as baseline CBC, complete blood count, which is WBC level, white blood cell count, red blood cell count, and platelet level. Always before starting any antibiotic, you need to have those lab works in your hand, or know that at least they were normal. When was the last time they checked it? Because if the patient has any liver disorder or kidney disorder and you started them on antibiotics, and then it might just go worse. So we need to have a baseline study. Now record urine output, and then make sure that you inform your physician if patient has any baseline liver disorder, kidney disorder, or any abnormal labs when you obtain them. Watch for signs of superinfection such as stomatitis. What is stomatitis? Infection, inflammation in the mouth, oral membrane. Genital discharge, vaginitis, which could be because of killing the regular body flora, and anal and genital itching. So those are all just signs of superinfection. Macrolides. Macrolides is another kind broad spectrum antibiotic. It inhibits how does it work? It inhibits the protein synthesis. Low doses, bacteriostatic. High doses, bactericidal. Okay. Medication. Meds could be azithromycin, clarithromycin, erythromycin. Now, azithromycin. Liver enzymes should be monitored when patient is being given. Why? Because it could cause hepatotoxicity. So if their liver function is bad, it could go worse. So we want to check their liver function always before giving antibiotics. Remember, liver function, kidney function, and a general CBC count is just standard for all antibiotics. Treat upper respiratory, so macrolides, these could be very good for upper respiratory tract infections, some STDs such as gonorrhea. And skin infections, we always have to check whether the patient has any allergies before we give medication. And this medication could be given to patients who have allergic to penicillin. Give 1 hour before and 2 hours after meal. It may be given with the food with GI upset. Take antacid 2 hours before, 2 hours after azithromycin. Contraindications in hepatic and renal dysfunction, bradycardia, and hypokalemia. Okay, tetracyclines, another set of antibiotics. So what do? They're broad spectrum antibiotics, usually taken 1 hour before, 2 hours after meals. So most of them you see that's just the way they are given. Except for doxycycline, which you will take with meals. So memorize this. Doxycycline is given with meals, okay? Monitor for superinfections such as stomatitis. What is stomatitis? Inflammation in the mouth membranes, remember? Okay, medications. Doxycycline and minocycline. Doxycycline, it should not be taken with antacids due to decreased absorption. Do not take with dairy products as it decreases the effectiveness. Take with food to improve absorption. Decrease the effectiveness of oral contraceptives. Renal and kidney function always should be monitored. Dish absorption is increased and can lead to dish toxicity. So that is drug-to-drug interaction. What is photosensitivity? When you go on light, you're not comfortable. So what you do is we wear sunblock and protective clothing. And those are your precautions. Next is fluoroquinolones. Fluoroquinolones, another set of antibiotics. What are these? These are bactericidal antibiotics, right? Some examples are ciprofloxacin, levofloxacin, moxifloxacin, right? Avelox. They are very good for severe infections in lungs, such as bronchitis, pneumonia, stomach infections, gastritis, and some STDs such as gonorrhea, right? Okay, so levofloxacin, it is used to treat pneumonia, bronchitis, sinusitis, UTI, different kinds of lung infections, urine infections, some skin infections. We can give them. This is like a broad spectrum. So you see, you can treat so many different kinds of infections with levofloxacin. Take before meals as food slows down absorption rate. Increase the effect of oral hypoglycemics. Have the patient monitor their sugars closely. And that is one of your test questions. So okay, with levofloxacin, what happens to your blood sugar? So it could cause severe hypoglycemia. So we tell the patient okay, what are signs of hypoglycemia? If you have diabetes, make sure that you have a snack available with you. Hypoglycemia is the sign when you have not eaten for a while and you feel tired, shaky, or restless or irritable. That is all signs of hypoglycemia, right? Monitor urine output and renal function. Monitor for superinfections, stomatitis, furry black tongue. So if someone has developed a furry black tongue, that is a sign of superinfection, means fungal infection in their mouth. It could be anal and genital discharges and itching. That's just part of fungal infections. Sulfonamides, another one. Bacteriostatic. These medications are bacteriostatic. They inhibit the bacterial synthesis of folic acid. They are used to treat UTI, ear infections, meningococcal meningitis, chlamydia, right? Chlamydia is another kind of STD, sexually transmitted disease. Medications, one of the very common medication, sulfonamide, is trimethoprim, sulfamethoxazole. also called as Bactrim. So for Bactrim, very commonly used medication for urinary tract infections. Otitis media is an infection in the ear, inner ear. Bronchitis, infection and inflammation in the lungs. Cystitis, infection of the urinary bladder. Okay, so all of those infections could be treated with, this is a very good one, right? Bactrim. What are the bad effects? Adverse effects are, it could cause seizure, leukopenia. What is leukopenia? Low amount of WBC count, white blood cell count, could cause infections. Stevens-Johnson syndrome is a syndrome of severe infection, complete body, severe allergies. So if a person could develop severe allergy, that is a Stevens-Johnson syndrome, like it has like boils all over the body. So that is severe allergic response. And renal failure, so we always check our liver function test and kidney function test before we give this medication. Watch for superinfection symptoms and report them to your provider. So if a patient says, you know what, I'm developing some oral ulcers, and so just, okay, call the doctor, just let them know, right? And drink quarts of water, like drink a lot of water, because water kind of flushes out infection, to prevent crystalluria and kidney stone formation. And monitor urine output. We want to make sure it should be at least 1200 ml in a day, right? Or other words could be 30 ml an hour. 30 ml an hour. Urine output should never be less than 30 ml an hour. And increase hypoglycemic effects with antidiabetic drugs. Monitor for hypoglycemia. So those are your sulfonamides. Tuberculosis. What is tuberculosis? It's a deadly disease. It is a disease of lungs. When can a person develop and how does it transfer, or how can you get it? It is through droplet infection. So if someone's coughing and sneezing, and if they have TB in their lungs, it's very easy to catch it. So it is transmitted by droplet infection, right? So TB is transmitted from one person to another person by droplet dispersed in air through coughing and sneezing. TB patients are on airborne isolation. The symptoms include, what are the symptoms of TB? Cough. There's times when people have blood coming in their sputum when they're coughing, and then they're like coughing out blood. That could be just a sign of TB or pulmonary edema. High fever, night sweats, anorexia. What's anorexia? They don't want to eat. Okay, prophylaxis. So whenever, let's say if someone is diagnosed with TB, we want their family members to take some antibiotics too. Not only we treat the patient, we also treat their family members, their roommates. Now there's times when we should also check whether patient has some HIV or not, because TB always happens to patients who are severely immunocompromised. So HIV, we check for HIV patients with positive TB test, and then we check for hospital personnel who are exposed to TB patients before it was diagnosed. Usually given prophylactic doses of isoniazid for 6 months to 1 year. So what is isoniazid? Also called as INH. It is a medication that is given to patients' family members for 6 months because if we know that they're exposed to the patient, that they need to be treated with this medication for 6 months. Patients who are susceptible to TB which patients could actually catch TB if their immune system is very weak, if they have if they're HIV positive, if they have debilitative conditions, means they're bedridden for a long time, their body is really sick. They could catch TB, because TB only happens when patient's immunity is very low. And then alcohol addiction. Okay, a TB skin test is ordered for anyone who is suspected of having TB or who has been in close contact with someone who has TB. What are the medications? So there are certain medications for TB. So drugs used for medication to treat tuberculosis or TB is isoniazid, rifampicin, ethambutol, pyrazinamide. Another one is streptomycin. So 5. Isoniazid, rifampicin, ethambutol, pyrazinamide, streptomycin. Try to memorize them, okay? Isoniazid. Now, what does it do? Also called as INH. right? So it inhibits the cell wall synthesis. It is given with other drugs to treat tuberculosis, given alone for prophylaxis treatment. Adverse effects of peripheral neuropathy. Peripheral neuropathy is like tingling and numbness, tingling in the feet and in the hand. If patient starts to develop that, then we give them vitamin. We always want to give patient vitamin C. So pyridoxine or vitamin C is usually given with isoniazid to decrease the probability of neuropathy. Alcohol ingestion can increase the incidence of peripheral neuropathy. Take INH or isoniazid 1 hour before, 2 hours after meals for better absorption. Teaching-wise, patients should get routine labs to monitor liver function. Make an eye appointment because isoniazid can cause visual disturbances. So a person could have problems in eye, they're not able to see. So if someone started to take isoniazid and they have problems in seeing, okay, check with your eye doctor. Take entire course of medication without skipping any dose. So that is standard for all antibiotics, right? Okay, antifungal medications. So some infections are fungal, okay? And fungal infections could be when a patient has very, very low immunity again. It could be oral thrush, just like white tongue or coated tongue, and then what's going on? It's a fungal infection of mouth, okay? A fungal infection of hair or nails or skin areas. There could be systemic fungal infections when patients bedridden for a long time, their immunity is very low, they might develop infections in the blood and in the body. Okay, involves lungs, CNS, central nervous system, and abdomen. Opportunistic infections occur in immunocompromised and debilitated population, such as people who are in nursing home, who have cancer or AIDS, right? Patients who have been sick for a long time. Antifungal drugs. So what are some antifungal drugs? One is very commonly used, amphotericin B. Amphotericin B, it treats systemic infections. Highly toxic, it could cause nephrotoxicity, which means it is really bad for kidney. It cannot be given to patients with renal dysfunction or transplants. Electrolyte imbalance, it could cause electrolyte imbalance such as hypokalemia or hypomagnesemia. Hepatotox is bad for liver. So remember, we always do kidney function test, liver function test, and a CBC levels before we give any medications, specifically all antibiotics. Okay, so low urine output, we check for urine output, and we check for BUN, blood urea nitrogen, and creatinine. What's your normal BUN levels? 10 to 20. What's your creatinine level? 1. Okay, nystatin. So nystatin is another medication that is used for candidiasis, which is a fungal infection. It could be an oral infection or skin infection. It comes in suspension form. Sometimes it comes in a cream form, ointment form, or tablets, vaginal tablets. With suspension, you should swish the liquid in your mouth, coating your entire mouth and thoroughly, and then swallow. So there's like when it comes in a liquid form, we say, okay, squish and swallow. What is squish and swallow? Take it like by mouth and squish your mouth with it and swallow. So it coats that, it takes care of that infection. Do not eat or drink liquid for 30 minutes after using nystatin. All right, fluconazole. Fluconazole is used to treat candida infections and cryptococcal meningitis. Increases time when taking warfarin, and increases hypoglycemia when taking diabetic medications. So fluconazole is another antifungal medication. So another one is metronidazole. It is used to treat infections associated with GI tract. Alcohol should be avoided as it can cause facial flushing, severe headaches, tachycardia, palpitation, and dyspnea. Antivirals. Viruses are, now what are viruses? Some viral infections could be, sometimes we have throat infection and doctor says, you know what, you have just a viral infection, let's just wait, and sometimes it clears up by itself. And then if there's severe viral infection, then we have to take antivirals. So viruses are most difficult to eradicate, more than bacteria, used to prevent or delay the spread of viral infection. Viruses must reside in living host in order to survive and reproduce. Examples of common viruses are influenza. So influenza is influenza A and influenza B. Hepatitis, herpes virus. Then we have varicella zoster virus, hepatitis B, and cytomegalovirus. also called as CMV. Okay, antiviral drugs. Acyclovir. Acyclovir are also called as Zovirax. It's used to treat herpes simplex 1, herpes simplex 2. Herpes simplex 2 is a shingles. Side effects could be nausea, headache, lethargy, anemia, increased bleeding time. Nursing diagnosis. It could cause risk of infection, should avoid exposure to the pathogen. Impaired skin integrity due to rash, pruritus, and side effects. Now, herpes zoster. It is for herpes zoster, also called as shingles, which is type 2 herpes infection. We give 800 milligrams every 4 hours for 7 to 10 days. In herpes simplex, 400 milligram 3 times a day for 5 to 10 days. Drink plenty of water, and then perform oral care to prevent gingival hyperplasia, which is inflammation in the mouth and swollen gums. And patients should report any decrease in urine output, dizziness, anxiety, confusion to the physician, and always take it with food. Drugs for urinary tract infections. So certain times when we give certain medications for UTI, urinary tract infections. What are those? So urinary tract infection, upper urinary tract infections, also called as pyelonephritis. Nephritis means inflammation of kidneys, right? Pyelonephritis, the word says. Lower urinary tract infections or lower UTI are cystitis. So what is cystitis? Bladder infection, urinary bladder infection. Urethritis, it is inflammation of urethra. Prostatitis, inflammation of prostate. Now we give urinary tract antiseptics or anti-infectives in order to clear the infection. Some of them are bacteriostatic and some of them are bactericidal. Urinary tract analgesic will relieve the burning and itchiness in the urine. When a person is having frequency, urgency of urine, then sometimes we give them urinary tract analgesic. One of the examples is pyridium. Then we give them urinary stimulants, which increases the muscle tone for the urinary muscles. And if a person comes with urinary tract infections, we always do a culture sensitivity to find out what drug is the best drug to give. Now, examples for medications which we give for urinary tract infections. One is nitrofurantoin. Nitrofurantoin, another name for nitrofurantoin is macrodentin. Okay, it is used to treat acute and chronic urinary tract infections. Low doses bacteriostatic, high doses are bactericidal. Okay, take with food to decrease GI distress. Report promptly any decrease in urinary output. Patient must increase their fluid intake to assist in urination. Antacids decrease the absorption of macrodentin. Also, macrodentin decreases the effectiveness of oral contraceptives, so use a backup method. Rinse the mouth thoroughly after taking macrodentin because it can stain the teeth. And urine may turn a brown color with macrodentin, and that is normal. Pyridium. Pyridium is urinary tract analgesic, and it is given to relieve the urinary pain, burning, urgency that are symptomatic of lower urinary tract infections. Given concurrently with antibiotics, urine will turn a harmless reddish orange color. So we want to make sure we inform our patient that if they see an orange reddish color in the urine, it's not blood, it's just because of pyridium. The drug can alter the results of glucose urine tests, and also it could give them a false positive or negative. Okay, and so we want to make sure that we inform our patients. Most important is we inform our patient that the color of urine might turn into orange, and then don't be alarmed with that, right? So that's pretty much it on our discussion on antibiotics. Now this is a small little 35 minute class. I hope you enjoy it, and this was just the review of very most important points, so review the lecture, do your worksheet, and that would be it for today. Thank you for listening. Okay, have a wonderful weekend.